Washington, D.C., Ebru's Craig Boswell is live with a new report that says Obamacare could see 2 million additional Americans out of work. It is tonight's top story, and he joins us now live. Craig?
Logan, good evening to you. There are a lot of nuances here. The nonpartisan CBO says the health care law will prompt lower-income workers to limit their hours or leave the workforce. It's an effort to avoid losing the federal subsidies to help pay for health insurance. Republicans are pouncing on that. And either way, though, the White House is saying that it's focusing more on workers' choice and not on jobs. And the administration, though, is certainly on the defensive, and the CBO is answering a lot of questions. The head of the Congressional Budget Office was pressed to explain why the health care law will prompt more than 2 million people to quit jobs or cut hours.
By providing heavily subsidized health insurance to people with very low income and then withdrawing those subsidies as income rises, the act creates a disincentive for people to work.
Republicans say it supports their argument that Obamacare is a bad prescription for economic growth. The White House is pushing back.
CBO explicitly says that you're not going to see an increase in the unemployment rate.
Jason Furman, the top economist at the White House, says the report shows an impact on labor supply and not labor demand. But one of the problems for the White House is the CBO prediction of 2.3 million fewer full-time workers by 2021 as a result of the law is nearly 3 times previous estimates.
First of all, for many people, there's potentially an incentive to do more. There's an incentive for more entrepreneurship because you're not locked into a job. There's an incentive for employers to be able to hire more people because the cost of health care is lower.
The CBO also predicted Obamacare would enroll 1 million fewer uninsured Americans as a result of the botched rollout of the healthcare.gov website. Again, there are nuances in the numbers. The CBO report also said that it believes that 1 million deficit will be made up by 2017, and the Obamacare will hit its target mark, basically. Logan, expect to hear more about the job losses. A group of GOP senators also want to question the CBO, particularly on why several years ago they were talking about 800,000 job losses, and now it is well over 2 million. Logan, back to you.
So, Craig, it appears the bottom line is this: the less you make, the less you pay. So for some, this law, the Affordable Health Care Act, will be an incentive to work less.
Exactly. It's all about the subsidy right now. It's all about that subsidy, trying to maintain that subsidy. So the choice becomes earn more money or you get maximum help with your insurance coverage.
All right, Craig Boswell reporting live tonight from the nation's capital. Thanks so much for that report, Craig.